I'm Dr. Meenal, and I welcome you all to this Fearless Against Rabies, a show which is to create a public health awareness and an initiative by Human Biological Institute. So, before heading up, I wanted to give you a brief introduction about the company. Human Biologicals Limited is an initiative of Indian Immunologicals Limited. IIL was established by a National Dairy Development Board in 1982 as its unit and later registered as a company in 1999 with the same name Indian Immunologicals Limited. HBI was established in the year 1998 when the government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000. Subsequently, HBI launched another vaccine. Currently, we are the major player in human vaccine, a leader in ARV segment and present in around 60 countries. Three state-of-the-art manufacturing facilities are at Ooty, Gachibowli, and Karkapatla. HBI was forayed into the market of clinically proven wellness products and infertility range of hormones. So, our vision is shaping global healthcare by spearheading the One Health initiative, and our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. And we believe in providing affordable products with high quality through the continuous technical innovations and improvement to meet our customers' need. As a market leader, Yeah. As a market leader, we also take a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly packs for our flagship brand Abhairap and Abhairap PF. As a corporate social responsibility, we have adopted schools where IIL is providing infrastructure and basic facilities, including in helping midday meals program and in association with NDDB through our gift milk program. Hundreds of school going children are benefited daily. We have also donated oxygen generating plants to TIMS. So these are few informations about IIL. For more information, you can also log into www.indieimmune.com and you can follow us on Facebook, LinkedIn, Instagram, and YouTube as well. So Fearless Against Rabies is yet another initiative of HBI where we talk about everything and anything on rabies prevention. Fearless Against Rabies show is dedicated to yet another very important topic, which is pre-exposure prophylaxis for children and protecting the most vulnerable. So I wanted to give you all a brief introduction of the doctor today who is present with us, Dr. L Sridhar. Yeah. So Dr. L Sridhar is here with us today. He's an MBBS MD pediatrics. He has done an LLB as well. He's working right now in Safe Children Clinic in Hyderabad, Telangana. So I wanted to welcome doctor today.
Madam. First of all, I want to thank Human Biological Limited, a part of Indian Immunologicals. So it's a great initiative to bring about awareness for this rabies, which is a really fearsome disease. So most of the things people see that last time also we had a healthy discussion with a few more doctors. We thought it should be represent our our India saying that it should be included as a pre-exposure prophylaxis of 2 doses of 0.1 ml intradermal. If it is included in the curriculum of vaccination UIP or national immunization program, it will be helpful for all the, we can cut down the deaths of the rabies. which is the ultimate. The mortality, once the diagnosed, mortality is 100%. It can't be reversed. So the pre-exposure is very much important than post-exposure. Everyone says that when the dog was bite, the people will say that to take to the case to the either immunization center or doctors. Or, but I feel protecting the most vulnerable disease with pre-exposure prophylaxis for children, that will definitely help for the decrease the mortality of the rabies patients. So with this introduction, I feel it's a great initiative by Human Biological Institute. uh, Thank you, Minal, and the team who had made this today's will be very much energetic. And I request all the delegates who are on the YouTube platform, please type your questions or in the chat box, so that we can answer your doubts, or we can not doubts, I can say we can clarify your things, because everyone is a refreshment course, like, because everyone we know 5 doses are there with a booster dose of the post exposure. With pre exposure, according to WHO, 2 doses are there. So these are all the things you know very well, but it's only refreshment. If you have missed anything, just type in the chat box so that I can clarify your doubts. Thank you, ma'am. You can start.
Definitely, sir. As you correctly mentioned it, I just wanted to start with the basics first. Like, I wanted to get this information to our viewers, like what is rabies and why it is considered a fatal disease. Like, what are the symptom appears? Like, you can put some light on these topics.
Yeah, sure, Ninal. Rabies is a viral disease. First of all, I can say bullet-shaped virus, which is known as a rabies virus, which primarily affects the mammals. So most of the mammals, means the living mammal is human being. It is transmitted through the saliva of the infected animals via bites, scratches, and open wounds. Mainly the vectors are, one is rabies dogs, most of the canines, dogs and bats and rodents and cocoons. These are all the things where most of the cases are traced, and the people will be affected with this. The virus, what happens after the bite and open wound, if you don't immediately wash with or with the soap, what happens is it enters the nervous system. So the virus travels through the nervous system to the brain, leading to the inflammation and dysfunction. What happens is, how it enters. It enters to the neuromuscular junction. From there, it enters the spinal cord. From there, it travels daily around 1 inch per day, and it around 12 to 24 per day. It enters the brain and causes this dysfunction and causing inflammation. So once the clinical system symptoms manifest, such as fever, agitation, hallucination, or hydrophobia. And what is hydrophobia? It's a fear of water. Whenever you start giving water, you want to give the water, the laryngeal spasm will be there with the patient. So we have, I personally, nowadays, maybe few doctors may not be able to see the cases of rabies cases, but I have seen a case, so many cases in government general hospitals. So the disease is nearly always fatal. This is because the virus causes severe encephalitis. Because of the inflammation of the brain, it causes encephalitis, and once that central nervous system is compromised, recovery is impossible without prior intervention. So that is the basic course of the rabies. What is the virus? Is a single-stranded RNA virus leading to the bite with the more salivary, and leading to the, and if it is an indentation is with the muscle, more with the in the muscle, what happens is it penetrates in the neuromuscular junction, spinal cord, enters the brain, causing inflammation and dysfunction. This is the basic things, how the rabies vaccine invades the body of the human.
Definitely, sir. As you have correctly mentioned it. I just wanted to understand more about this, sir. Like, who are the individuals who are at risk of rabies exposure?
Yeah, we there are three different parts, ma'am. One is children. They don't know the real danger of bites or danger of rabies. So if a dog is seen by a child of 10 years or 5 years, he want to play with that. He don't know the condition of the dog. So especially under 15 years, they are more likely to interact with the animals, and they may not recognize the danger of bites. And second, people are more vulnerable. You know very well, the doctors who are working in a veterinary hospital, veterinarians and animal handlers, technicians, lab in charges, or all the blood sample collection lab technicians, and all the examination part team of the veterinary hospital, these are more prone for. And also travelers, particularly those visiting areas where rabies is prevalent and access to the medical care is limited. So those people with the late intervention, again the cause of mortality will be more. And the residents of the rural areas, most of the in urban zones you can't see that many dogs, but in rural areas stray dogs are populations are larger and immediate medical care may not be readily available. These are the things why we see most cases in children less than 15 years, and animal handlers and veterinarians, and travelers to the more endemic zones, and also residents of the rural areas where the stray dogs are more.
Yes, sir. Definitely. With this, I got the answer for common source of exposure as well, as you have correctly mentioned it. I wanted to move ahead to a prophylaxis. What is our aim to educate now? So, what is pre-exposure vaccination, and how does it is differ from post-exposure?
Pre-exposure vaccinations, basically what happens is the involves administrating a series of rabies vaccine doses before any potential exposure, because since these people are more prone for the rabies, what we want to do is there is a pre-exposure pre-exposure prophylaxis, administering a series of rabies vaccine before any potential exposure, because this proactive approach is recommended for individuals at higher risk of contracting rabies, such as I earlier said, animal handlers, veterinarians, laboratory workers, and also travelers. So, what happens is it is to induce protective immunity against the rabies virus, thereby reducing the risk of infection upon exposure. So, this is very important. And once on the other hand, is administered after a potential exposure of the rabies virus, such as if it is a post exposure. What happens? A bite or scratch from a potentially rabid animal, PEP, what is known as PEP, post exposure prophylaxis, typically include a series of rabies vaccine doses. And necessarily, if the category is 3 is there, we have to give the rabies immunoglobulin also to prevent the onset of the disease. So the effectiveness of PEP is highest when administered promptly after exposure. But as I said earlier, the pre-exposure prophylaxis has to be implemented in our national immunization program. I request human biological, a part of the government. You are also a part of government. The British biologicals are these immunologicals are in everything, because what happens is human biologicals. What happens is you can request the government, and from the doctors, all the senior doctors are KOLs. You take a letter from the doctors that pre-exposure prophylaxis please implement in the national immunization program, so that the fatality and mortality will come down.
Definitely, sir. What you said is exactly the same thing which we are looking forward. I wanted to understand more about the pre-exposure, like what is the standard vaccination schedule for it, and how effective is it in preventing?
Yeah, sure, ma'am. See, what happens is there are things available according to the WHO and the Centers of Disease CDC control of prevention. Two doses is recommended in the intramuscular regime. First dose should be given at 0 day, and second dose should be given at day 7. So, with this 2 day 2 dose regimen, will be protective effect. The protection will be good against the rabies for up to 3 years. So after that, we can give, if required, we can give 1 dose of pre-exposure prophylaxis. But as per the WHO and the CDC, we recommend 2 doses of IM regimen. One is 0 dose and day 7.
Yes, sir. Sir, I just wanted to ask you a little more about it. Like, as you correctly mentioned, 2 doses are required. By a single dose of rabies vaccine, like that will be provided lifelong immunity.
Currently, there is no single dose vaccine approved for lifelong immunity, madam. However, research is going on to develop more efficient vaccination strategies, but still, till now, it's not. But the immune protection, if you give a single dose, single vaccination, it may last for 25 weeks or around 7 to 8 months. And after that, the 2 dose strategy could extend this duration 1 year or longer. I feel the 2 dose regimen should be followed. One day, I think one dose, till now, research is going on. There's no single dose rabies vaccine approved.
Yes, sir. So why we consider children are at a higher risk group for rabies exposure?
As earlier said, madam, children will be happy to play with that, all the animals, canines, because they don't know what is the risk of the bite and what is the risk of the rabies or other infections also. So what happens is, children are particularly vulnerable to the rabies exposure due to several factors. One is, especially those are under 15, most likely to be bitten by the dogs, and behavioral factors. Children may approach animals readily but may not recognize the danger of rabies. Children want to play with them, but the children will be feared to touch the dog outside sometimes. That fearness will make them run, and the dog will catch hold and have a bite. And second thing, main important is lack of awareness. Children, we can't, that IQ will not be there, but parents also, lack of awareness, limited understanding of the risks. That's the thing, lack of awareness, and delay reporting if dog bit is there. After 3 days or 4 days, they come to the doctor and show that the dog had bitten. So they shouldn't delay the vaccination or required immunoglobulin. So what I feel is, the delay seeking medical attention is again second. First is lack of awareness and delay in seeking medical attention. These two are important parts which we have to highlight in the need for preventing measures, ma'am.
Definitely, sir. And I think so. Regarding this, we have few things in our current guidelines also in PRP
Yes.
in India, and I just wanted to understand how they're evolving.
Previously, I have a German Shepherd, madam, in my house. So previously, I used to have a Great Dane. So at that time, we have taken 3 doses of pre-exposure prophylaxis, 0728. But now, as per the WHO and as per the CDC, 2 doses are required. And there are so many vaccine types are there. Only modern tissue culture vaccines, such as purified chick embryo vaccine and purified viro cell rabies vaccine, these are the recommended for both pre-exposure and also post-exposure prophylaxis. So there are evolving guidelines also. So for those things, what I as earlier said, consideration for the universal immunization and also implementation challenges. These two are important to consider, madam, always in the vaccination schedule. These two are important.
Definitely, sir. Sir, are there any common side effects of this rabies vaccine or how they can be managed further?
Yeah, there are very few, ma'am. I would have given around for 100 to more than 100 to 150 patients who had after dog bitten, but we never see. But still, some common side effects are there, where local reaction, pain, redness, swelling will be there, and itching at the site. And systemic reactions may be few: headache, nausea, abdominal pain, muscle aches, dizziness. These are the few. And rare reactions, any anaphylactic reaction is very rare. And don't fear about the make with this is the scenario where we ought to educate to take the vaccine. So less common side effects and management. These minor reactions and severe reaction can be managed at the house itself or in the hospital itself with simple ibuprofen and acetaminophen. And also severe reactions, definitely we have to give some anti-allergic and some steroid drug for that. Nothing will happen, ma'am. You go with a good there will not be any side effects, but only the pre-exposure prophylaxis and post-exposure prophylaxis has to be taken by the patient, either child or adult.
Definitely, sir. Sir, are there any contraindications for receiving the rabies vaccine? Like,
To say, really, there are no any absolute contraindications are not there, but still there are relative contraindications. One is severe allergic reaction is there already. Patient is getting a severe allergic reactions. Then we have to take care of the. Before that, we have to mention that in the prescription, and also be ready with all the anaphylactic things, injectables like oxygen. Basic things are oxygen, IV fluids, and adrenaline. These to be kept in ready in all the clinics, and before doing any, not only this rabies vaccine, any vaccine. And if the patient is having weakened immune system, and if you have the child or adult is having any HIV, cancer, or those undergoing treatment that suppress the immune system, may have a reduced response to the vaccine. And also pregnancy and breastfeeding. While the rabies vaccine is generally considered safe during pregnancy and breastfeeding, it should only be administered if the potential benefits outweigh the risks. This is the things we have to take care of the immune system, but we can give the vaccine in all the patients, in all the conditions. But in few cases, maybe reduced response to the vaccine may be there. That is only you should keep in mind.
Yes, sir. I was just going through the chats for the viewers, what they are posting for the questions. So they have written very useful and important topic. Then, sir, there is one question. Please tell us the cats and dogs can spread rabies in their incubation
Yes,
period as
yes.
well.
See, the cat, the all the canines, all the cats, dogs, bats can spread rabies in their incubation period. But there are studies they can spread in their incubation period also. We can't say. See, the incubation period lasts from 10 days to 90 days or 50 days. In that incubation, the day one itself can cause the dog or cat can have the rabies. So we should take the preventive measure. If the dog or cat had a rabies in their incubation period also, we have to take care of the post-exposure prophylaxis for the mammals.
Yes, sir. So more question, which is like which vaccine this how we can be this vaccine can be administered, and is there any specific consideration for different age groups?
uh, there is no like any space age specific considerations are very few. And children, the vaccine is safe for children when administered the appropriate dose and schedule. And coming to the adults, again, the recommendation schedule should be given based on exposure risk category wise. And elderly, older patient may have a slightly reduced, as I earlier said, because of the immunity and the resistance power of the, as the age increases in the geriatric group, the immune response will be less. However, the vaccine is still recommended if exposure risk is present. And special populations, as earlier said, pregnancy and the breastfeeding and immunocompromised individual also, the the definite, if the vaccine is given, the benefit outweighs the risks. So we has to give the vaccine at any cost for the exposed patient.
So there is a wonderful question in the chat box. Like if someone has taken pre-exposure earlier, does that person still need an anti-rabies vaccination after a dog bite?
Yes, ma'am. Yes, ma'am. This is already we in the discussion part also will be given. The patient has to take the post-exposure prophylaxis. Has to be given for the, if the pre-exposure will reduce the risk of rabies. But if you once the, after taking the pre-exposure prophylaxis, if the still the person still need to take the ARV after a dog bite, that is indicated. But we do have the studies, 3 doses is sufficient. We don't need any 5 doses and booster dose. 3 doses are sufficient for the, if a patient already taken by the pre-exposure, 3 doses are sufficient.
Definitely, sir. Sir, how this public awareness campaigns improves rabies prevention efforts? Like, what are your thoughts on
This
this?
is very important. Out of all the questions, this is the first important, ma'am. Public awareness campaigns play a very crucial role in rabies prevention. One is we have to educate the community, where they informing the public about the risks of rabies and importance of preventive measures. And also we have to tell them about the pre-exposure prophylaxis and post-exposure prophylaxis, and also immunoglobulin. And main important, the availability, where it is available in the government sector or in the private sectors, where it is available, we have to educate them. And we have to tell them that prompt medical attention after exposure should be done. And second, also promoting responsible pet ownership, but means to vaccinate their animals against rabies. All the pet animals has to be vaccinated by the owners of the pets. And third important is encouraging timely medical interventions whenever the seeking immediate medical care after bite, and so that we can decrease the developing rabies. And engage schools and communities in the school literature also. We have to tell them this about the rabies risk and pre-exposure and post-exposure, and we have to tell them, teach them, children and adults, about the rabies prevention and importance of reporting animal bites. And next next is policy implementation. We have to advocate the policies supporting the rabies control measures, a mass dog vaccination campaigns, and inclusion of rabies prevention in national health programs. As earlier said, I request the government to go for vaccination in the national immunization program. It's a intradermal. It's a zero point 0.5 ml is not required. 0.1 ml is sufficient for the intradermal, and two doses if you give, we can save so many lives. And in instance in Goa, for example, a coalition of non-government organizations and local authorities led a successful rabies education campaign that reached over 5 lakh children and significantly reduced rabies death in the region. So either we have to request government or some non-governmental organizations, non-governmental bodies to help in this matter, and so that we can take the permission from the governments and also companies like yourself, and so that we can have a good decrease in the rabies deaths.
Definitely, sir. So one question which is popping again and again in the chat box is: do we need to take a pre-exposure dose if a pet which I'm having is
you
already
have to
vaccinated?
you have to take, because as per the book says, as per the Nelson or all the book says, that if you have a pet dog which is already vaccinated also, better to take the pre-exposure dose of 2 doses. And as per the previous strategies, 3 doses. Now CDC and WHO advising 2 doses you have to take. That is a better for all the public who are handling their pet dogs and other dogs also.
Yes, sir. So coming to the last question, what is the key message that should be communicated to the public regarding the rabies and its prevention?
Always I say advocacy, effective public awareness campaigns should be communicated with the key messages. Rabies, first, rabies is a fatal preventable diseases, and seek immediate medical care, and vaccinate your pets against rabies. And most maximum, you try to avoid contacts and stray with the stray animals, so that the rabies will not be decrease, and you also to reduce the risk of bites.
Definitely, sir. With this, I thank for your presence. I really appreciate the valuable time which you have given to us and sharing such a clear and very strong message for the importance of pre-exposure for the rabies. And we feel that this session will very much informative for the public, and this will create an awareness. So this video will be there in fearlessagainstrabies.com. Anyone can come back and watch it. Thank you so much, sir. Thank you
Thank
so
you.
much.
Thank you so much, Minal, and thank you, this Human Biological and Indian Immunologicals Limited. Thanks for giving me this opportunity, and we hope we'll have a great time. And in future also, whenever any sessions like next coming to the hepatitis A awareness also, I'm ready to come forward to give the questionnaires and questions and clarify the doubts for the all the doctors, practicing doctors, and also public. Thank you, one and all.
Thank you so much, sir.